epidemiologist and science communicator at the University of Ottawa, Dr. Raywat Deonandan. Welcome back.
Thank you.
What do you think of the vaccine rollout plan?
It's a plan. It's hard to say what the right thing to do is. There's an argument to be had that we should do this based on age and nothing else. Let's inoculate all of the elderly and define that however you like. There's an argument to be said that we should inoculate only the super spreaders or those people at high risk of exposure. It's unclear what gets us the biggest bang for our buck. But I think the way that we planned it seems rational.
With the super spreaders approach, that's bound to be controversial if they said, yes, let's go to the people who seem like they're the most likely to spread the virus because they're not following the rules, and let's inoculate them first.
Yeah, I don't advise that path be taken, but there is an argument to be had. I don't think the public buy-in would be good for that one.
I'll have to call the finance minister down in St. Bart's and let him know, just to let him know that hasn't been discussed yet, because perhaps he would be front of the line in regards to that behavior, going on a trip down to St. Bart's. Okay, but you like the plan. You like that there is somewhat of a plan. Is it detailed enough, given that we're still months away from mass vaccinations?
Yeah, it's detailed enough. I mean, we want herd immunity, and herd immunity is maybe 70, maybe 80% of the population, but we can get herd effects if we use the tools strategically in the interim. So what does that mean? If we protect those people most likely to fill the hospitals, and if we protect those people that we need to keep society functioning, so the healthcare workers and first responders. So with that strategy in mind, we can get something resembling normality and less fear in society. And I think that's not a bad goal to go by.
On a serious note, the finance minister is going to be coming back. He's in hot water over his pandemic trip to the Caribbean. But what are the dangers of doing that right now, of traveling abroad, doing what he's done?
We should not be traveling. For one thing, you could go and infect another country, perhaps a country that is less able to deal with the pandemic because their healthcare system is not as good. But selfishly, you could bring back infection, and that's what we're most concerned about. Right now, our ability to monitor incoming travelers is frankly poor, and the extent to which we enforce quarantine is also poor. So the incoming travelers don't really constitute a large percentage of transmission, but they are responsible for some transmission. And with the new variants floating around the world, we don't want to risk bringing in more of those cases. So it's not advisable to have open skies at all. And I think any kind of travel should be essential travel and nothing else.
Bill Blair today said travel has decreased by about 90% during the pandemic, and about 2% of confirmed cases in Canada originated directly from travel. So 2% is pretty low, but still, we could get that down.
2% of a large number is a large number. And plus, that's 2% that we know of.
That we know of, right? And your point is that we may not know, which is even more troubling. We may not be able to actually connect it back to travel.
Yes, a big chunk of cases are untraceable. And it could be travel related, it could be something else.
So then what do you think about this requirement now that people coming to Canada are going to have to get a negative COVID-19 test before arriving in our country?
Why not? This should have been done a long time ago. Look, there are at least three characteristics that the countries that have done this well all share. Number one is that they acted early, they acted hard. Number two, they got really good at case identification, that's testing and tracing. Number three, they monitored their borders for incoming reinfection. That's what we should have been doing for a long time now. And it's not a hard thing to do. It just takes political will and the application of our testing capacity. So I think it's a good move.
There's international concern and a lot of conversation about the new variant of COVID-19 in the UK. We know it is here in Ottawa. Could we test the wastewater to track and look for the new variant specifically?
In theory, you could. What we're talking about here is something called genomic surveillance. So a given PCR test probably isn't sufficient to determine whether or not it is the new variant. I mean, there are proxy measurements you could use. What we want is to be able to sequence an actual virus that we sample. So we have to take occasional samplings and then do entire genomic sequencing. So, we have to apply the resources to that task. We could do it probably.
You could do it. And so then you'd be testing for the old strain and the new strain in the water?
Well, it would be an expensive endeavor because genomic
Right.
sequencing is more intensive. So you
Sure.
have to do a sample, like maybe a 5 or 10% of the samples you take, you do further, deeper investigation. What the UK has done is they've used, I don't want to get too deep into the woods here, but the PCR test looks at 3 different genes, and one of those genes might be different in the new variant. And so if that third gene is not triggering the same signal, you can conclude that maybe that's a new variant. We can make hand-waving arguments about it. So hopefully public health is looking into that.
Yeah. Do you think there's merit in doing that? You said it's expensive, it takes time, but would it actually be valuable?
As an epidemiologist, I always want more information. So I say, yes, do it if you can. Absolutely. But at this stage, we should just be trying to get the numbers down. Now, let's say there is a new variant present. What does that change? It doesn't change a whole lot. We still have to do what we have to do, which is, diminish transmission, wear your mask, keep your distance. What we can do as individuals does not change. It's what the state can do that changes. Close more things down, for example, close schools down. So in that sense, a different kind of genomic surveillance needs to take place. Like maybe 20% of all the positive PCR tests that come back should be deeper investigated in the labs.
Interesting. Okay. So aside from the new variant, I just want to look at what's happening in Ottawa by the numbers right now. We have a positivity rate that is now up from what it was. It's 2.5%. COVID in the wastewater is up as well. And the number of COVID-19 cases per 100,000 is up as well. So it's 40 cases per 100,000. What do those numbers say to you?
It says what we thought was going to happen, which is after the holidays, we would see greater transmission. And with greater transmission, we're going to see a percentage of those resulting in hospitalization, and a percentage of those, unfortunately, will die.
And we're only 5 days out from Christmas. It's December 30th.
Yeah, but the socialization began before Christmas. Mm-hmm. And the new lockdowns, if you want to call it that, only started a couple of days ago. So we won't be seeing that effect for another couple of weeks. So we're looking at several weeks of hardship, unfortunately. And I don't want to say to people, we've been through this before. We know what it's going to look like, and we know what we have to do. So let's just do it.
Dr. Paul Remiliotis, who's located in Eastern Ontario, was saying that he doesn't think a 28-day lockdown is going to be enough. And he said he believes not only will the lockdown measures not end early, but he also thinks they're going to be extended. What do you think about us here in Ottawa? What do you think is going to be needed after this 28 days?
It's possible. I mean, it's impossible to tell the future, but I wouldn't discount him entirely, especially if the new variant becomes the dominant strain, in which case the schools are in greater jeopardy. So it may get to that point, which means let's accelerate that vaccine dispersal as much as we can. That's our best way out of this now, all things considered. But yeah, it's entirely possible. We have to be in economic restrictions for longer than a month.
So you said if the new variant becomes the dominant strain, we may need more than the 28-day lockdown. Why does that matter if it becomes the dominant strain?
Well, dominant variant rather than dominant strain. I keep using those words. Because if it's more transmissible, it means a higher likelihood of greater hospitalization and death because more people become infected and more people therefore will be seriously ill. And we're already at close to capacity. So we cannot tolerate that much more stress on the system. And the new variant, the data just suggests that it may be 50% more transmissible in children 0 to 9, in which case the schools now become a greater probability of pandemic accelerators. So closing schools becomes more likely. So we really don't want that variant to be the predominant variant in our community.
Dr. Deonandan, great to have you on the show, and Happy New Year. We won't be talking to you until 2021, so thank you so much for coming on the show, for being patient and giving us some of your time. We really value it, and we appreciate it.
Oh, thank you very much.
Dr. Raywat Deonandan, who's an epidemiologist and science communicator at the University of Ottawa. Oh, darn, I missed out on my opportunity to ask him about his motto for 2021. You can still email me yours, though.